Whether it's Alzheimer's dementia or other less common types like frontotemporal dementia, people are often concerned about how it affects their loved ones. What is frontotemporal dementia? What causes it? What can you do to prevent having it? And how do you manage this disease if you already have it? We'll also discuss 7 things you can do to protect your brain. Frontotemporal dementia (FTD) has become a hotter topic since the family of Bruce Willis, the phenomenal actor, was gracious enough to let us know he had been diagnosed with FTD. His family made this announcement to bring some attention to this disease, a very commendable act from the family, and my heart goes out to them. We are grateful for the Willis family's enlightenment in this condition. So what is frontotemporal dementia? This is a group of diseases that damages the frontal and temporal lobes of the brain. These are parts of the brain located on the front and sides of the brain, and they are essential for language, thinking, problem solving, behavior, impulse control, motivation, and personality. The frontal lobe is known as the executive center of the brain. Frontotemporal dementia usually starts with changes in behavior, language, or movement. Eventually, it leads to difficulty communicating and living without constant care and supervision. In some cases, your doctor may refer to FTD as frontotemporal lobar degeneration or Pick's disease. FTD is not as common as Alzheimer's dementia, the most common form of dementia. However, for people under the age of 60, FTD is the most common form of dementia. It can even occur as early as 45 years for some people. FTD is different from Alzheimer's dementia. In Alzheimer's dementia, the frontal lobe is spared longer as the parietal and temporal lobes are mostly affected. These are on the sides and top of the brain. This means memory is affected more in Alzheimer's dementia, but not as much with FTD, at least initially. Because FTD can present very early in life, it can be easy to miss this diagnosis. Depending on the type of FTD, the symptoms can show up as rude or odd behaviors, impulsivity, difficulty speaking or understanding words and recognizing faces and objects, movement disorder, as well as various personality changes. Frontotemporal dementia is the biological equivalent of spotty cell service, leading to dropped calls and texts that won't go through as your communication falters. So what causes FTD? Well, scientists know that when you have FTD, some of your brain cells, called neurons, die off, and this causes your brain to shrink. No one knows precisely why this happens, but it is more common in men, especially those with a family history of this condition. Some studies also show that thyroid disease and a history of head injury increase your risk of frontotemporal dementia. Unfortunately, this disease does not have a cure. This makes it important to try to prevent it in the first place. Generally speaking, 2 components contribute to the development of many diseases: genetics and lifestyle. This means that you may have inherited the genes to have a specific disease, but it does not mean you'll definitely develop the condition. Twin studies have shown that even with the same genes, certain diseases can be avoided or controlled with a healthier lifestyle. The lifestyle component aims to delay the onset of FTD even if you have the genes. With just lifestyle changes, it may be possible to delay the onset of this disease. So you want to make changes to your lifestyle early to slow down or altogether avoid this brain cell death and shrinking. Let's briefly discuss 7 things you can do to protect your brain. Number 1, cut out or minimize added sugars. These have a high glycemic index and can lead to insulin resistance. In addition, sugars also affect the gut microbiome and lead to inflammation in the brain and body. They're found in cakes, candies, cookies, salad dressings, ketchup, baked beans, and other canned foods. Number 2, minimize your carbohydrate intake, especially if you have insulin resistance. This can occur in cases of diabetes and prediabetes. Some studies have shown intermittent fasting and keto diet to be beneficial for the brain. The Mediterranean diet is another healthy diet option to consider. Number 3, cut back on processed plant oils. These bad oils are usually polyprocessed vegetable oils, which are high in omega-6s and as such cause a lot of inflammation in the brain and body. They promote insulin resistance and also contain high amounts of trans fats. These are directly toxic to the brain and also affect the gut-brain axis. Consider healthier cooking oils like coconut and olive oils. Number 4, exercise. The American Board of Lifestyle Medicine recommends 150 minutes of moderate intensity aerobic exercise per week. Brisk walking, biking, and swimming are some examples. Strength training is also helpful for optimum performance. Number 5, hobbies. Continue to engage in healthy hobbies to keep you active and motivated. It also helps your mental health when you have something exciting to look forward to. Number 6, social relationships. We're social beings, and it is essential for us to continue to interact with family and friends. It may also help to volunteer and join clubs and other meetups to encourage social interactions. Number 7, meditation and yoga. These have been shown to reduce stress and support overall brain function. There are several excellent tools and apps you can use for meditation. Returning to Bruce Willis, his daughter recently gave a public update on his condition. She states that his condition is ever evolving, but he continues to do well. We're thankful for that and wish him well. Check out this next video for 3 nutrients you need for brain health.